12:30 the time here on the Deli in the Cafe with Brian Dust. How you doing?
Well, you could say we're drinking beer and wasting bullets, but that's just the name of the last song I played.
Well, that's a great song. That's awesome. I did Money Talks from AC/DC, and it does talk.
That's right.
Anyway, here's the money girl right here. She's a doctor. She's rolling in it, right?
Mommy girl, yeah, sure. That's what you
Welcome
want
back.
to think.
I'm thinking so. All you rich doctors just doing what you do. She's not rich. She got 43 kids to take care of. Anyway, Dr. April Ritz in the house here from F&M Pelvic Health and Wellness. Good to have you. Facebook Live as well. How's it going?
It's going well.
Did you find your way in here?
I did.
Good.
Deanne said, go find the back door. And I'm like, hey, where's the back door? But I'm like, it can't be that hard. I'll find it.
You'll find it sooner or later. Just find a door that opens and you can come in. Anyway, but we're not here to talk about our construction. Are you a construction girl? Are you like a fix-it-up girl at home? I'm kind of curious.
My husband's all about that.
Oh.
I used to do mission trips, like home repair mission trips and
Did
building,
ya?
building
you could
wheelchair
do it.
ramps and stuff. So
That's part of it.
I can do it, but I let my husband do all the stuff at home.
I understand. But if you would like to start in here, there's wide open space here. Let's go.
Yeah, could use some help.
Anyway, let's talk about things happening with you. We got, what do you want to talk about today?
Well, so last week, I'm sure most people are probably aware that are women, that there was an announcement that they changed the labels on hormone replacement therapy for menopause and perimenopause. So RFK Jr., HSH secretary, took off the black box warnings for those, which should have been taken off way back when. It was all back in 2022 or 2002. There was a study done that they ended up putting on all the hormone replacement therapy for women going through menopause, that there's all these risks for other things, but it was based off a study that wasn't very great in the first place. So
Okay.
it's a good news that black box warning has been taken off of those hormone replacement therapies for women going through perimenopause and menopause. And as a physical therapist, doctor of physical therapy, I don't prescribe hormones.
Oh, okay.
But I work closely with nurse practitioners and doctors that do, and we see a lot of patients in our clinic with perimenopause, menopause, pelvic floor symptoms. So Tiffany Mosley and I teach a class on pelvic health and menopause coming up on December 4th that I wanted to invite everybody to attend if you're in that 35, 40, 50 range, because all women are going to go through this at some point, and they need to be educated and know what's best for them. And there's a lot of old school thought around treatment in this area, so we bring updated evidence-based practice in our class.
Very interesting. I don't know anything you're talking about.
You're like, sounds good, sounds good.
Whatever you say, doc. That's why we have doctors, right?
I've never even heard of a black box warning, so that's a first too.
I thought those were on airplanes when they crash. And a black box. Anyway.
Okay, so some changes.
Some changes.
Yeah.
Some changes for women for the better, and making more hormone replacement a better option. So when it comes, maybe you guys can understand this language for pelvic floor therapy. So a lot of people ask, like, what actually happens to the pelvic floor during perimenopause and menopause?
Yeah.
Okay. So do you guys know what the female main hormone is?
Big E.
Estrogen.
Estrogen. Good job.
I'm
And there's
married. I
also
know this stuff.
progesterone.
Oh, yeah. They got a
But
couple more.
yes. So with this time frame, when our hormones are going crazy, typically estrogen starts to drop. And that means our pelvic floor tissue becomes thinner, drier, and less elastic.
Oh.
So we may see weakening of the muscles. This can be more bladder or bowel leakage issues. We can lose coordination. A lot more women will start having pelvic heaviness or seeing prolapse issues during this time, as well as like pain with intimacy and bladder urgency. So these are all changes that are considered common for women going through this, but
Sure.
they're not necessarily normal, and they don't have to live with them.
Okay. So there are steps to take, and on that is mainly the drugs you were talking about, the
Yes.
Hormone.
Yeah,
So
the hormone replacement,
replacement. So if we're
Thank you.
talking about the pelvic floor symptoms, I often recommend topical vaginal estrogen cream in conjunction with pelvic floor physical therapy. So first line treatment for those symptoms of urinary urgency, pelvic heaviness, leakage, pain with intercourse, all of those, best treatment is a topical estrogen cream with pelvic floor physical therapy together.
So those two work together very well.
Yes,
to get
and
you
that's
back
why-
to feeling much better.
Yeah, and that's why I'm like the hormone component. I can't write out a script for that, but I refer back to the doctor for that.
Sure, and they can.
Okay.
All right, just work
Yeah.
together. It's good that you're working together with other doctors and stuff.
Yes.
Yeah.
Because you're all are in the same thing. You want to make the patient feel the best.
Yeah, we want them to feel better, and
Right.
sometimes it requires a full team approach.
All right, kind of like changing tires and stuff. You just had to have more than one people in the pit stop. What else we got here?
We always say we're body mechanics, not car mechanics. We're body
Oh,
mechanics.
I like
Oh,
that.
I've never heard that.
Body mechanics, very good.
Fill her up.
It says here, a key talking point you wanted to talk about is
Oh.
what does pelvic floor therapy do?
Yes.
What is that? What
Hmm.
can you, in a few minutes, tell us a little bit about how that works out?
Yeah, so not just for perimenopause and menopause. With all of our patients, you're going to be assessed by one of our doctors of therapy. There's 3 of us at the clinic, and we will be looking at your coordination of your breathing. We'll be looking at coordination of your pelvic floor muscles. Can you squeeze? Can you relax? Are you able to coordinate your breath with it? Sounds a lot harder than what it is.
Okay.
I had several patients this week that are like, is breathing supposed to be this difficult? I'm like, well, we're
Oh.
coordinating your rib cage, your diaphragm, your abdomen, your pelvic floor. There's a lot to go into it.
Okay.
And most people aren't able to breathe properly.
Huh.
We're also looking at the hips because our hip strength, flexibility, all of that plays a role in our pelvic floor because the muscles are connected. So we're teaching people how to get those muscles coordinated, how to breathe properly. If the muscles are too tight, we work on relaxing them. So like I always say, Kegels are not for everybody, but some people do need to be doing Kegels as well.
Mm-hmm.
And then we'll address whether it's bladder leakage, if they need support for a prolapse, depending on what the issue is that they're coming in for. We will then a lot of education too around fluid intake and diet, bowel habits, bladder habits. That's what we always do. I actually saw a patient recently with prostatectomy,
Okay.
and he was having urinary leakage issues. And I said, "What did the doctor tell you?" And he's like, "One sentence. That should take 4 months, and this should be completely better." And I
Hmm.
said, "And anything else?" He told me I could buy this book of exercises, so I bought it.
Hmm.
And he came in, and we did a 2-hour evaluation. And I was like, "Can you now see why it's more than just a one sentence like solution to
Mhm.
urinary issues or erectile dysfunction after a
It could be,
prostatectomy
it
surgery?"
could be all so many things.
Yeah, and he goes, "Yeah, in that book of exercises I bought, they are doing them wrong in that book."
Oh, no.
Because yeah, so I always tell people are like, "Why do you spend 2 hours with the initial evaluation?" There's just so much detail that we have to like consider, and it's not just a simple, here's one exercise, you can go home. It takes time to put the whole picture together.
Yeah.
We're like little detectives, putting it all together and figuring out why are you having this issue in the first place, and what now can we do to make it better.
Not only a mechanic,
A detective.
a detective as well.
Yes.
Detective mechanic. I like this.
Sherlock, right there.
Of the pelvic floor.
Or you could be Dr. Watson. I don't know. Anyway, this is very interesting.
Yeah.
We talk about all these cool things over the last few years, and I hope it's reaching people and it's in their mindset that they do not have to have these issues. They can be taken care of.
For sure. And also, if we're just thinking about like not prostatectomies, but like post hysterectomies, we help with that, or like old C-section scars if women are still having pain. There's just so many different areas that happen in the abdomen and pelvic floor that they all connect. So if we're having urgency issues, if we're having pain, abdominal pain, constipation, all those things are connected together.
All
I
right.
always love when patients come in and they are like, "Okay, I really just scheduled this one appointment because I want one exercise or 2 exercises." And
Yeah.
I'm like, "We can't do that. Like, you've had this issue for how many years? 10 years?
Yeah.
15 years?"
You can't just
It's
flip
not just
switch and
it's
you're
not
good.
yeah, it's not a one exercise. So it's putting the picture together and addressing all the issues. And yes, your back pain is connected to your pelvic floor issues. Your hip issues are also connected to your pelvic floor issues. It's all tied together.
Yep.
Sounds like a lot to learn and
If it
a lot
was
to do.
if it was easy, just a one-time exercise, that would be awesome. I would do that all the time.
Oh, it'd be awesome.
I wouldn't have to work my detective brain. You
That's
know?
right, yeah.
Here's one exercise. Here's an exercise. But it
Take
just
this
doesn't-
out. All right.
Doesn't work like that.
All right. So maybe somebody's out there and they're when should they get a hold of you in your office? Where to the point, or where do they have to do that?
Yes. So I always say we would love to see you if you're ready to make change and ready to commit to doing some exercises. If you want a pill or an easy fix, our clinic is not for you. We are going to make you do the work. It takes time for us to get where our bodies are, so we have to put the work in to get back and fully recover. So if you're having leakage issues, urinary or bowel, if you're having back pain, hip pain, pelvic pain, any heaviness, bulging sensation, core weakness, pelvic dryness issues, urgency, frequent trips to the bathroom. All of those things are things we can help with, but we don't, I'm going to be honest, we don't want to see you until you're ready to get better yourself.
Okay.
Yeah,
So,
there you go.
That makes perfect sense, because if you're not going to do the work, why even bother? Because it's not going to work. You gotta work together and get this thing figured out.
yeah, so if you're tired of dealing with those issues and you're ready to address it, just call our office. We don't need a referral from your doctor. Just call us so we can get you scheduled. Our goal is to get people in within 1 to 2 weeks. We don't want people waiting for a long time to get into the clinic. So yeah, just give us a call. Our number is 217-705-5077. We are also on Facebook, FEM Pelvic Health. You can find us on YouTube, and all these radio interviews we do as well are on
Indeed.
there,
Yep.
and some exercises. So
All that good stuff. And if you want to, is when you have these classes you got,
Yeah.
is that a good thing? Do you get a lot of, after people sit through these classes, they're like, hey, I need to talk to a doctor and all this stuff.
it makes a lot more sense to them. And sometimes people are ready right then to like, okay, let's do something about this. But then other people, it's like they just have the information, so they know when to reach out if a problem comes up.
Okay.
So we had our women's wellness event, and that went awesome.
Good.
Our next event is the December 4th event, which is that perimenopause menopause class. That is $25, and it typically always sells out. We do have a few spots left for it still. And then follow us on Facebook and our website, because we have all of our classes on there as well. But we do have I guess our next class isn't December 4th. Our next class is next Tuesday at the library.
Oh.
I'm doing working with Flying Buddha. They're doing a free Pilates class, and I'm doing the pelvic floor component of
Okay.
that. So that is a free class for everybody in the community. Next Tuesday, call the library to register for that. And then we have dates coming up. We also have a free breastfeeding class at the clinic on December 11th. You can call us for more information. And then I did sell out of our menstrual health fifth vital sign class for moms and daughters that
Oh,
go
really?
together.
Yeah.
Our clinic was completely full, so I moved locations
Oh.
for that. So that is January 15th, and I am doing a discount for that class right now. It's only $10. Normally it's
Oh.
$10 for the whole family to come.
Oh, okay. Very
For
good.
mom and all the daughters.
Very good.
Or if there is no mom, dad and the daughters can come
Sure.
too, because dads don't know this information.
Oh,
So
we need to know more about it than
All
anybody,
right.
probably.
yeah. So
Sounds awesome. You got things going on.
No kidding.
You just keep doing what you're doing. I think
We
we're going
will.
to be okay.
Can you do one more thing for us? Could you change that industry word, what is it, perimenopause, to just premenopause? It looks like they spell it wrong every time. They switch the E and the R around. I'm hoping that would mean the same thing.
it's pretty much the same. It's the
Okay.
same thing. Yes. Yes.
Don't confuse-
Premenopause
Don't
is
confuse
yes.
that guy over there.
Yes. And do you guys remember what menopause is? What's the actual definition of when you are in menopause?
Oh, man, you did this once.
You guys should know this. 12 months
Oh,
without.
without a period.
Good job!
Oh,
Good
good
job,
job.
Brian. Good
I
job,
was
Brian.
like-
12 months. Yes, 12 months without a period.
I'm just
That's
gonna
when you're technically in menopause.
I'm just going to say 6'7". That's all I know. You know,
6'7".
It's a 6'7". Anyway, we thank you, and we wish you well, and have a great Thanksgiving if you don't see you, okay?
Yeah.
Happy Thanksgiving to you guys too.
All right, BD.